So we all know it's important to brush our teeth, right? But what if I told you that's only one part of caring for your mouth properly? Because you see, our mouth has more than just teeth in it. We have our gums, we have our tongue, we have saliva, and a whole living microbiome within it. And these days, we hear much about the gut microbiome and gut health in relation to our overall health. Well, the mouth has its own microbiome too, and that's important because the mouth is the first part of the gut. And if you haven't heard the term microbiome before, it's simply an ecosystem or a community of microorganisms, including bacteria, that live in and on our body. And the mouth has over 6 billion bacteria in it. And some of these are beneficial and some of these are potentially harmful. And I like to think of the oral microbiome as a city. And different bacteria live in different parts of the mouth, like the suburbs of a city. Some are on the tongue, some are on the gums, and some are on and between the teeth. And like a city, the environment matters. So when the environment of the mouth is healthy and balanced, and by that I mean the saliva is flowing well, the tissues are healthy, and the mouth isn't always acidic, then the microbiome does well and the beneficial bacteria thrive. So the mouth is a very important organ, not only because of its intimate connection to the gut and indeed the rest of the body, but also because of the many important functions it performs. It allows us to communicate with our outer world and nourish our inner world. It connects us to our outer world through speech, song, even our facial expressions, such as a smile or a frown. And when we look to our inner world, it nourishes us through drink, through food and taste, and even air if you're a mouth breather. And if we haven't met before, hi, I'm Dr. Aushi Patel, and I'm a holistic dentist. And today I want to walk you through what I believe, after over 30 years in clinical practice and caring for thousands of patients, to be a more complete approach to daily oral care. And what I'm going to share with you today is simple, practical, and can be woven into your everyday life in just a few minutes. So today is the beginning of a series where I'll give you the overall framework, and then in future videos, we'll take a deeper dive into each practice. So if you'd like to be notified, please do go ahead and press that subscribe button. And when done properly, your oral care routine is one of the most powerful preventative tools you'll ever have. And you can think of it like maintaining a car. You wouldn't ignore signs of damage over the years and then expect it to work perfectly, would you? And the mouth is the same way. So it's the small daily practices done consistently that matter. And prevention is always better than repair. So let's move on to the first step, and that's cleaning the teeth. And yes, brushing is the foundation of this ritual. And brushing your teeth shouldn't be about scrubbing them. It should be about cleaning them thoroughly and gently. And I recommend small circular motions around all the surfaces of the teeth. So the outer, the biting, and the inner surfaces. And making sure that you brush around the gum line too, because that's where many of the bacteria in the mouth live. And I'm often asked by my patients who have receding gums if they should be brushing around the gum line. And my answer is yes, because if they don't brush around there, they'll end up with an inflammation of the gum and then a gingivitis, which is not ideal. And this could lead to further gum recession. But I do say they should use the softest bristle brush they can find, and that could even be a baby's toothbrush. And as a bit of fun, you might want to try swapping hands when you brush your teeth. So using your non-dominant hand. So if you're right-handed, use your left hand to brush. And you might find it slows you down, but you might also be more aware and mindful of how you're brushing. And I tried this a few weeks ago, and initially it was really awkward. And then I started to notice that I was noticing how I was brushing. So if you do give it a try, let me know how you go in the comments below. So when you brush is just as important as how you brush. And I recommend waiting about 10 to 15 minutes after a meal before you brush your teeth. And the reason is, it gives our saliva time to neutralize the acids in our mouth and start remineralizing our teeth. It's like the body's natural repair mechanism. How amazing is that? And if you've had something quite acidic, like a lemon water, apple cider vinegar, even a kombucha, then I would wait at least an hour before you brush. Because you see, the acid actually softens the enamel on the surfaces of our teeth. And if we brush too soon, we are scraping that enamel off. And this can lead to erosion, teeth sensitivity, and even yellowing of the teeth. And the second step in cleaning the teeth is cleaning between the teeth. Because no matter how good your toothbrush is, it can't reach these surfaces. And plaque can sit undisturbed between the teeth and cause gum disease and tooth decay. So whether you use floss, interdental brushes, or even a water flosser, it's important to make sure that you clean between your teeth every day as well. And then we move on to the tongue. And I feel that this is often an overlooked part of the mouth, considering how much space it takes up. And in my previous video, I talked about how overnight, bacteria, dead cells, and metabolic waste can build up on our tongue. And if this layer isn't cleaned away, it can affect our breath, our sense of taste, and even the overall health of our mouth. And tongue cleaning has been a part of Ayurveda for thousands of years. It's simple yet powerful. And we'll take a deeper dive into this in a future video. And the next step is optional, but I think it's a nice finishing touch to the ritual. And that is mouth washing. And one way you can do this is by oil pulling. And oil pulling is an ancient Ayurvedic practice whereby oil is swished throughout the mouth and then spat out. And traditionally, sesame oil was used. But for dental health, you can also use coconut oil. And many of my patients tell me that their mouth just feels cleaner and fresher after they've done this. And if oil pulling's not your thing, you can use a herbal mouthwash. But please make sure to avoid ingredients like fluoride, artificial colorings, and foaming agents. And even the simplest act of washing your mouth out with water or sipping a herbal tea can be good for the mouth. Now you may notice different practitioners may have slightly different sequences to cleaning the mouth. Some may say clean the tongue first, others may say oil pull first. And honestly, it really doesn't matter, as long as you're consistent and thorough. And the way I've explained it to you is the way I explain it to my patients, because it's easy to remember this way. So I basically say, when you brush your teeth and you clean your tongue, you're sweeping your floor. And then the oil pull or the mouthwash is the final mop. And remember, this isn't about perfection. It's about a few mindful minutes a day to look after one of the most active parts of your body. And in the next video, we'll take a deeper dive into how to choose the right toothbrush. So I'd love to know in the comments below, what part of this ritual would you like to know more about?